Hello, everyone. Welcome back to BioNexus Health podcast series. Today, I have decided to speak about family matters. And let's find out what that is, shall we?
Welcome to the BioNexus Health podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health podcast, Dr. Jodie A. Dashore.
I've been asked if there's anything that can be used on a daily basis to maintain good health in the family. Family members of all ages, from siblings to grandparents, can have many different kinds of medical problems and diagnoses actually, because after all, everyone is living in the same environment. So if your child on the spectrum, or if one family member has biotoxin illness or autism, and any kind of environmental toxicity, that obviously is the same issue, maybe to a much lesser extent in other family members, because everyone, like I said, is exposed to the same environment, right? So that has prompted this question from many of you, and many of you have mentioned individual family problems during your regular appointments, and we have discussed. I actually have several families where I am literally seeing, everyone from mom, dad, brothers, sisters, grandparents, as well as the child on the spectrum. And again, it's not always an autism issue. It could just be, something like biotoxin illness or Lyme disease on its own, but other family members are also affected. Okay, especially with biotoxin illness and mold exposure. It leads to a lot of chronic inflammation and things like sinus issues. Other family members often have things like sinus issues, heavy duty seasonal allergies, hay fever, pretty heavy food sensitivities, digestive problems, headaches, migraines, memory issues. Siblings can have ADHD. I have quite a number of moms and dads who also have ADHD issues. Thyroid problems are very common. I will do a separate podcast on thyroid problems, Additionally, heavy hitters like MS, lupus, Parkinson's, Alzheimer's have also been associated with chronic inflammation. So I have grandparents, with these chronic neurodegenerative conditions. And I've been asked if there is anything that can be done to help. So depending on severity of issues and illness, I usually recommend they either become a patient or, we can just discuss during your regular follow-up. If there are minor issues, we can always discuss during your regular follow-up. Okay, before I proceed, I wanted to give a shout out to Rafiq and Hana in Dubai. You had asked me something similar at our last appointment, and I'm sure you understood, but I didn't hang up on you. It was the meeting that timed out and something went off with Zoom. But I'm happy to discuss at your next appointment. Hopefully, today's podcast will give you some answers as well. Okay. Now, the cold and flu protocol from my previous podcast works well for other family members, going through similar issues. However, what can be used on a daily basis to maintain good health in the family? All right, so let's begin at the beginning. The nasal spray, Formula One NSV, the nasal spray is the first line of defense, isn't it? It's your sinuses, right? A lot of bacterial, viral, microbial exposure can be when you're breathing. So using the nasal spray once a day is an excellent idea. Now, family members that have, nasal congestion, headaches, migraines, sinus problems, they can all benefit from the nasal spray. Formula One. Let me know at your individual appointments what the age is, and if there is any specific modifications that I need to do to the dosage. I'm happy to do that. But nasal spray is usually 2 sprays each nostril at least once a day. Now, if you know that you have been exposed to allergens, pollution, mold, etc., then do the nasal spray right away as soon as you get home. That's going to be beneficial. Before I proceed, I wanted to make you aware that mycoplasma, marcons in the sinuses, parasites, and strep. These are very easily transmitted amongst family members. Additionally, if one family member has H. pylori in their stool test, that is also, quite commonly transmitted, especially if you are sharing the same bathroom. So keep that in mind. One of the reasons why my family had all started being treated, it was because it was recommended by many specialists that we saw, especially in Germany and Switzerland, as well as a couple of specialists right here in the US. The basis of that thought being, if mom and dad and siblings are carriers of certain triggers for PANS, PANDAS, strep is a big trigger, staph can be a trigger. So multiple microbial infections, mycoplasma can also be a trigger for PANS, PANDAS. So you will get into a feeling better, then again a flare-up, feeling better, then again a flare-up situation with the child that has been diagnosed with autism or PANS, PANDAS. So that is something to keep in mind. And, overall, when we went through, myself and the family, when the entire family went through a proper cleanse, we actually did labs, blood work was done, and we discovered a lot of infections with myself, with Brian's dad, and all of that was treated. It greatly benefited our health as well. So, all right, so let's go back to the list. Nasal spray, done. Then let's go to the next one. The next one is the Daily OM blend. So the Daily OM blend is multimicrobial. It has inbuilt liver support as well, which, as we know, is very important. Now the Daily OM blend can be built up to 10 drops once a day, right? This is just, a daily health benefit. But if you are looking for a deeper cleanse, then like I said, discuss at your follow-up, and I'm happy to help. Another point to note is with the Daily OM blend, it's multimicrobial. You're doing it once a day. It's best to usually do it in the morning, before you leave the house. Or if you feel that, you feel really fatigued and tired at the end of the day, and that you need some support after you get back home from school, from sports, from work, whatever that may be, then yes, you can certainly do either a second dose if you feel that your exposure is heavy, or you can do your one maintenance dose at that time when you come back home. So I'm going to leave that to you. One other tip is that, if you are eating street food or street snacks, then remember to come back and do the daily OM blend one more time. This is excellent preventive. Next in line would be a good refrigerated probiotic. Now, actually, let's back up a little bit, right? There is a probiotic in the BioNexus store. It's the Megaspore. Now, Megaspore, it is a slightly different advanced technology, and you can just use it twice a week. You don't even need it every day. So twice a week, remember, this is just for the family members for maintenance. Now, don't go changing anyone else's full BioNexus protocol if another family member already has a full BioNexus protocol and is an active patient. Please follow that protocol. This is for the other family members for general health maintenance. Okay, so Megaspore is great for the family. You just need to do it a couple times a week. Twice a week is just fine. It has a very long shelf life without refrigeration, so that would be a good choice. Okay, now next I would recommend a simple binder like activated charcoal. You can do that, do 1 to 2 capsules at least once or twice a week. Once again, weigh it out, right? 2 capsules once a week, last thing before you go to bed, is fine. However, if you feel that it's been, an extra stressful week, you've been exposed to a lot of pollution, a lot of allergens, right? You've been in a poor environment, then by all means, you can do that twice a week, right? Midweek and end of the week. Works really well. What you can get locally is a good multivitamin that is non-methylated. Now, one of my projects in the next few months is not only those speech and tension and focus anxiety supplements, vagus nerve supplement, the essential oil blend for hair massage, right? Head massage, for brain development, reduction of brain inflammation, etc. Remember, I had spoken to you guys about that in another podcast. Well, that is absolutely happening. It'll be out within a couple months. Additionally, my plan is to formulate a non-methylated multivitamin that is simple, because most of the products that I find available out there are trying to be different and they're adding too many things in there. It's just too much of a good thing is not a good thing. I say that over and over again, don't I? Because we've had such horrific personal experiences with, practitioners in the past for my son that we had seen in a cowboy manner, hey, do 5 trillion probiotics and really heavy dose thyroid support, heavy dose iodine, etc. That was devastating. It can be devastating. Since then, I've seen many people who've been over methylated, and they just don't understand because heavy methylation is recommended by practitioners. They of course look at the MTHFR labs, and I feel that methylated supplements are prescribed way before they should be. So if inflammation is not addressed, then methylation is futile. it's just going to cause additional issues, detox reactions. It can even cause die-off reactions. It can even cause exacerbation in inflammation. So just be very gentle with any kind of methylation. So anyways, coming back to this new product, I'm in the process of formulating one, and it'll be something very simple, not extremely high doses, because I'm very blessed. Most of my families follow a good diet. Whatever they feed the patient, the child on the spectrum, or someone else who is my patient, whatever diet is decided upon, a similar diet, maybe not all of the same restrictions, of course, but a similar diet is followed by most family members, and it works wonders. Seriously, once your health starts to improve, I mean, of course, most people tend to stick with the plan, right? So most families in my care don't really need a heavy-duty multivitamin, because you know why? Because the gut is handled, detoxification is handled, organ support is handled. So what happens? What is the benefit? Wait, microbes are handled, infections, here and there, they're handled. So what is the overall benefit? Your digestion, your absorption of nutrients, assimilation of nutrients is beautiful. It is optimal. And a heavy-duty multivitamin isn't even required. All right, so I will, of course, let everyone know when that multivitamin is ready and available. It'll be in the dispensary, it'll be in the store. Okay, now moving on. Remember to do a parasite cleanse once a year, at least once a year. Twice a year if you have pets. If you have dogs and cats or any other pet, remember to do a parasite cleanse twice a year. Veterinarians do a parasite cleanse for our pets, right? But no one informs us humans that we need that as well. Now, I'm not going to elaborate, there's that's a whole other topic if you have pets. But many people already know this, that it's important to do a full parasite cleanse twice a year if you have pets and once a year if you don't. Formula 6A PBS and Formula 6B PBS, 20 drops twice a day for 1 month for adults. And for children, there would be 10 drops twice a day for 1 month. Okay. Now, children 12 and older should be able to do 20 drops twice a day. But, remember, it's a slow buildup. Don't be gung-ho, about the whole thing and say, hey, I'm in fantastic shape. I'm just going to go with like 20 drops twice a day, stat, like right away. You can't do that, right? You know that BioNexus herbals are biodynamic. They are artisanal, small batch made, very pure. So please build up slowly. Cool. All right. Now, once again, the formulas I've spoken of in my previous podcast will be released soon. You can always speak to me about other family members briefly, and I'm happy to advise during your regular appointments, because it is important for the family to be healthy together, right? I'm sure you all agree. Okay, now, to keep things easy, I shall have my IT team create a family care bundle in the store. So you just, it's just going to be one click away for you. Remember, the cold and flu bundle has already been created. So we've made that very easy for you. Go ahead, have a look in the dispensary store, and it should be right there. This bundle give it a day or two. But I guess, you know what, by the time the podcast is released, it should be there. Yeah. So once again, it's that time. I need to go now, but it was very nice having you join me today. Thank you. As always, be well, and I will see you at the next episode of BioNexus Health Podcast. Namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.